Absolutely. We saw this in DAPA-HF, completely consistent effect, patients with and without diabetes. Maybe this has been the problem. Maybe cardiologists are still thinking, although this is rather old-fashioned thinking, that these are treatments only for diabetes. They're not. They are a treatment for diabetes, but they are also a treatment for heart failure. We've repurposed SGLT2 inhibitors to be treatment for heart failure. It's like sildenafil. It was introduced as a treatment for erectile dysfunction, but we cardiologists use it today as a treatment for pulmonary hypertension. It's the same molecule, but it's two completely different indications. So yes, useful glucose lowering therapy for diabetes, but this is our drug. This is a heart failure drug, and we can do a huge amount of good for our patients. Well, it is correct that we did show reduction in new onset diabetes amongst those patients who didn't have diabetes at baseline in DAPA-HF. The same analyses have not been presented for EMPEROR-reduced, so we don't know if that's the case with empagliflozin, but I would anticipate broadly similar effects because these drugs are similar in structure and act in the same way, but we haven't seen those data. We only know that for dapagliflozin at the moment. I don't think there's much debate about it. It's a great additional benefit to have. So if you're a patient with heart failure, the last thing you want to do is to develop diabetes as well. So that is what I would call a bonus of this therapy. It does all the good things I mentioned earlier, improve symptoms, reduce hospital admission, reduce mortality. We know also reduces worsening renal function. And now this is an additional benefit, reduces new onset diabetes. So no controversy, no discussion, great bonus effect in patients who don't have diabetes at the moment. Who are at very high risk developing diabetes. That's maybe not often realized. Heart failure is an extremely diabetogenic state. So it's great that we can reduce or delay the development of new onset diabetes. It's fantastic to be in this new era of heart failure therapy in the space of 5 years to have two fantastic new treatments, completely complementary and additive to the other therapies that we have. It's a great time to be a doctor treating patients with heart failure, and hopefully it's a great time for our patients with heart failure because we now have so much more to offer them if they get the therapy. So the key from here on is implementation. So we, the trialists, have given our colleagues the evidence. We need everybody now to put that evidence into practice.